Hello, I am Dr. Atul Limaye. I am the Director of Interventional Cardiology at Fortis Hospital, Mulund. Today we are going to discuss an unusual condition called SCAD, which is nothing but Spontaneous Coronary Artery Dissection. It is an unusual condition that typically happens mostly in women of childbearing age who do not have the traditional risk factors for heart disease such as high blood pressure, diabetes, smoking, etc. It happens to women who are sometimes under intense emotional stress also. What actually happens is that the coronary arteries which supply blood to the heart, there is a rent or a tear in the layers of one or more of these coronary arteries. As you can imagine, if there is a tear in the layers of the coronary arteries, the blood starts to clot or coagulate in that layer, and then it leads to further blockages in that artery as that tear starts to extend in the length of that particular artery. What are some of the signs of SCAD? Well, the signs of spontaneous coronary artery dissection are just like a typical heart attack. It is very difficult to distinguish spontaneous dissection without doing an angiogram, because the signs and symptoms and even the ECG and blood markers are very similar to someone having an acute heart attack. In these situations, the doctors typically do an angiogram and understand the nature of the coronary artery dissection. Sometimes coronary artery dissection can be managed just with medicines and blood thinners. At other times, if the dissection is severe, they may require the implantation of a coronary stent, just as it is required when patients have a heart attack. It is important to have knowledge about this condition because, as I said, it is an unusual condition that happens in women who do not have the traditional risk factors which we associate with coronary artery disease.